of Allah. Today I want to describe cervical cancer. First of all, I want to discuss female genital system or anatomy. This is the vagina, this is the uterus, this is the ovary, in the uterus attached by stacked a tube-like structure that is called fallopian tubes. This is the cervix. This is the cervix junctional area, and these are the anatomy of the female genital tract. The female genital location is here. This is the vagina. This is the uterus system, uterus organ. This is the fallopian tube which attach the ovary. This is the ovary. This is the uterus, cervix. And this is the tumors which is found in also called the cancers. This is the vagina. We also have different stage in the vagina. This is the uterus, cervix, vagina, and this is the transitional zone area. The cervix and vagina is attached to each other. This is called transitional or zone area. When the malignancy or lesion is started, this is the early stage of the cervical cancer, which is the first of all the cervical cancer is found the transitional zones. The transitional zone is increased day by day, month by month, year by years. That is this is the first stage. This is the second stage cervical cancer. This is the last stage. The last stage is the stage which increase the to invasive the parametria. The malignancy or malignant tissues invade to parametria, involve the parametria area, and the end stage, the malignancy start the bleedings. The patient has the bleeding in vagina. The most common causes in the vaginal cancer or the cervical cancer is the most common cause is the human papillomavirus. Closely it shows around to will white, pale yellow and white color dots. How can to diagnose in this human papillomavirus in pap smear? We want to screen the patient for malignancy, and that the easy procedures which we performed and diagnosed by pap smears. This is the cervix, in the brush scraping, cells for sampling. This is the uterus, vagina. We enter the speculums and dilate the vagina. In that times we also enter the brush. We scrap the transitional zones. The transitional zone is scrapped in the in the smears, make the smear pap smears. And that times we want to check the smear by microscope and see different cells. Good screening stage pre-cancerous cells changes, which we saw in the pap smears. This is the normal cervix. This is the cervical cancers. This is the normal cervix. There is no seen the lesions, and this image shows the lesion in the cervix. This is called the cervical cancer. This is called normal cervix. This is very important. We should do screen greater than 18 years females. The normal histology, we have the normal histology in four layers. This is the basal layer. This is the basal layer, which is this is the basal layer. This is the parabasal layer. This is the intermediate layer. In this is the superficial layer. We have three layers. The basal layers. This is which one, two. This is the basal layer. 1, 2 layer is the parabasal layers. 1, 2, this is the intermediate layers. 3, 4 layers is the superficial layers. Superficial cells is the normal cells which we show pink nucleus, round tubular nucleus. Is the when we diagnose the human papillomavirus or other atypical cells, we classified in stage that the CN1, CN2, CN3s. The normal cells is the normal cells compared to the low squamous intraepithelial lesion. Now this CN1 is called low squamous intraepithelial lesions, and the CN2, this is the previous term was the previous terms. Now the new classifications term used LSIL and HSILs. The low squamous intraepithelial cells. This is the intermediate cells, intermediate nucleus, round to oval hyperchromatics with irregular nucleus. This is the high nucleus squamous intraepithelial lesion, which is the in situ is increased hyperchromatics. Is CN3, the category is CN3 in count. When we diagnose the HPV, the most common type is 16-18 is which is caused the cervical cancers. We came to diagnose that in the pap smear by pap smears. This is the superficial cells, intermediate cells, parabasal metaplastic cells, this low squamous intraepithelial lesions, this is the high squamous intraepithelial lesions. Now we go to the benign and reactive changes. How can to know benign and reactive changes? Benign squamous changes, benign induced cervical changes, refer radiation changes, cellular changes associated with intra-devices, glandular status, post hysterectomy, or other benign changes. Is the benign squamous cell changes. Benign squamous cell changes is the benign squamous cell changes is which is in large the nucleus, enlarged high nucleus, enlarged nuclei, coarse chromatin, hyperchromatic with abundant cytoplasms. The nuclear membrane is irregular. It might be the cause of the intermediate squamous cells from perimenopausal women. Such is the nuclei shows blunt nuclear enlargement, should be mistaken for sometimes significant ATPR. The similar blunt nuclear enlargement can occur squamous metaplasia. This is also the blunt nuclear can be seen in squamous metaplasia. In these two pictures shows the this is the non-specific allows. This picture shows non-specific perinuclear halo. In this picture shows specific perinuclear halos. How can to differentiate each other? This is the pseudo or non-specific halos. And this is the clear or true specific perinuclear nuclear halos. This is which is the cause of the HPV virus, human papillomavirus. Some in the A category shows which is non-specific allows are small around the nucleus of squamous cells in non-specific and do not represent human papillomavirus. This is not cause the human papillomavirus. But in this halo is some normal squamous cell have abundant glycogens. This is the hal abundant glycogen. This is show abundant glycogen that mimic chyliocytosis. This is also called mimic chyliocytosis. That is caused or significant feature of the HPV virus. And also the active endocervical cells. How can to identify the active endocervical cells with this cell shows enlarged high enlarged nucleus, hyperchromatic, coarse chromatin with prominent nucleoli. This is called active endocervical cells. But this is different from that. This is also active, but this is different from that cell. This the nucleus is enlarged, highly isolated, and in big mature squamous cells. Mimic low-grade squamous intraepithelial lesion. It might be low squamous intraepithelial lesion because the in situ is increased, hyperchromatic, prominent nucleoli, coarse chromatins. This all featured or characteristic is the low squamous intraepithelial lesions. Cytomorphology of refer cohesive blood-shaped streaming appearance, large nucleus with marked size variation, large nucleolus, sometimes irregular in shape, palchromatin mitosis. Differential diagnosis of refer non-keratinizing squamous cell carcinoma. It also differentiate endocervical adenocarcinoma. This is the active endocervical changes, which is the shows the microgranular hyperplasia. These cells are enlarged in how prominent large cytoplasmic vacuoles. Typical refer, this picture shows typical refer, which is the refractive epithelium is cohesive in arranged in monolarge streaming sheets. This is made up one streaming sheets arranged in one sheets. Cytomorphology of radiation changes, large bizarre cells, normal nuclear to cytoplasmic ratio, cytoplasmic coagulations, and polychromasia, and also have multinucleation. Differential diagnosis of radiation changes with herpes, cytopathic changes, recurrent cancer with and low squamous intraepithelial lesions. Cytomorphology of uterine device effects might be shows vacuolated cells, small dark cells with skinned cytoplasm. Differential diagnosis issue to do of intrauterine device effect with adenocarcinoma and high squamous cells intraepithelial lesions. Is the radiation changes which the nucleus is increased or also show the prominent nucleoli in coarse chromatins in multinucleations. This also causes of the intrauterine device, which is the changes in shows the high nucleocytoplasmic ratio coarse chromatin, but there is no prominent nuclei in cells. This is the cytoplasmic coagulation is found the cytoplasmic coagulation. This is the cause of the intrauterine device. Sometimes also the glandular status postectomy also cause the squamous changes present after squamous changes. The squamous mucosa of the vagina has undergone focal mucus metaplasia. This is the also the glandular changes which is found the vacuolization, cytoplasmic vacuolization, hyperchromasia, and the nucleus is located eccentrically. endometriosis of the cervix. How can to diagnose the dark cytosulfide nuclear of endometrial type epithelium mimic endocervical metaplasia scenes. We can to the pulse measures mimic endocervical metaplasia but cannot be completely diagnosed in pap smears. B in a cervical biopsy revealed the tiltar mix of benign endometrial pain in streaming. Is the endometrial gland? Is the endometrial gland? Is the endometrial stroma?